Hello, everyone. Welcome to Cracking Addiction. My name's Dr. Ferghal Armstrong, and today we're going to have a quick run through the causes of addiction. Now, this is a very simple explanation of a very complicated subject, so I apologize for viewers or to viewers who have a greater understanding of this subject. But it's important to understand that virtually all substances that have a potential abuse or the risk of addiction have a common final pathway of increasing dopamine in the reward system of the brain, which is in the mesolimbic system and ends in the nucleus accumbens. And dopamine is the molecule in the brain that makes us go, gimme, gimme, gimme. It makes us want to do it again. It doesn't necessarily make us like what we're doing, but it makes us want to do it again. So, for instance, people who want to stop smoking, they frequently state that they don't like the fact that they smoke, but they just can't stop it because they've got this gimme, gimme, gimme neurotransmitter. Beyond that, beyond the fact that there's this dopamine, of this elevation of dopamine, we need to understand the broad causes of addiction. And firstly, we need to understand that there is a genetic vulnerability to addiction. And whilst there is no specific addiction gene, according to genomic wide studies, which study small single nucleotide polymorphisms in the entire genome, there's about 100 of these that actually contribute to the genetic vulnerability of addiction. And these slight changes in the genome contribute to about 50% of the risk of addiction. Now, the figure varies drug to drug, but basically half of addiction, or rather half of the vulnerability to addiction, is genetic. Then we need to think about the role of specific drugs. We need to understand that different drugs have different addiction potentials. And funny enough, the substance that is the most addictive that we know is actually tobacco, nicotine. Nicotine is the most addictive substance known to man, followed by heroin, followed by cocaine, followed by alcohol, followed by stimulants other than cocaine, followed by cannabis, followed by hypnotic drugs that we would prescribe like benzodiazepines, and then followed by analgesic drugs that we prescribe like prescription opioids. So there's a hierarchy of addictive potential. And not every drug has the same addictive potential as any other drug. And so you need to start putting that into this complex interplay of what causes addiction. And then we need to move into what I call the environmental or exposure risk factors. Now, the National Institute on Drug Abuse, NIDA, which is a US funded agency, demonstrated a number of risk factors for addiction and protective factors for addiction. And they classified these risk factors and protective factors according to various domains. So if we look at the individual domain, they found that people with a large amount of self-control were less likely to use drugs, or if they did use drugs, were less likely to become addicted to those drugs. Whereas people who had a history of early aggressive behavior, or for instance, oppositional defiant disorder or conduct disorder, these individuals were more likely to become addicted to drugs. And then in the domain of family, people who grew up in a protective family where parents were watching them and giving them the right message were less likely to become addicted, whereas people growing up with a lack of parental supervision were more likely to become addicted. And then in the peer domain, people who had were able to do well in school, who had academic competence, according to NIDA, they were less likely to become addicted, whereas people who were exposed to substance abuse within their peer group, they were more likely to become addicted. And then we have the domain of school. And it's no surprise that children growing up in schools where there are tight anti-drug policies were less likely to become addicted, whereas children growing up in schools where there were where there was the easy availability of substances, they were more likely to be addicted. And then finally, we have communities. So children growing up in with strong neighborhood attachment, so in communities where there's a lot of social cohesion, they were less likely to become addicted, whereas children growing up in poverty, without that social cohesion, they were more likely to become addicted. And it is on that basis that I contend that addiction really is a symptom of social inequity. Now, NIDA did not actually address what I consider to be a very big risk factor for drug addiction, and that is a history of trauma, and in particularly child abuse. And recent research from Australia has actually demonstrated the relationship between childhood mistreatment in all its forms and also the relationship with both risky behavior and also addiction. So, if we first of all look at the prevalence of child abuse, we can actually see that overall, over 60% of adults have been exposed to some form of childhood mistreatment. And that can include physical abuse, sexual abuse, emotional abuse, neglect, and also exposure to domestic violence. And the most common form of childhood mistreatment is actually this exposure to domestic violence, whereas the least common is childhood neglect. Now, this study actually demonstrated an effect, an association between the history of childhood mistreatment and risky behavior and substance use. So we'll look at risky behavior next. So you're 1.2 times more likely to develop obesity if you've been exposed to childhood mistreatment. You're 1.9 times more likely to be a smoker. You're 1.3 times more likely to binge drink, at least weekly. And of course, binge drinking is now defined as drinking more than 4 standard drinks on any one occasion. You're 3.9 times more likely to have self-harmed in the last 12 months. You're 4.6 times more likely to have attempted suicide in the last 12 months. And you're actually, if we're now veering off into the addictions realm, where you're 6.2 times more likely to be cannabis dependent if you have been exposed to childhood mistreatment. And this effect is pervasive and long lasting. So these risk factors actually continue way into adulthood, way beyond the age of 45. So your experiences as a child can actually determine your behaviors well into adulthood and also increase your risk of risky behaviors. Now, if we look actually the effects on mental health and addiction, you're 2.8 times more likely to have any mental health disorder. You're 4.6 times more likely to have current PTSD, post-traumatic stress disorder. You're 3.1 times more likely to have an anxiety disorder. And you're 3.2 times more likely to have a depressive disorder. And going back to the binge drinking, so previously we said that if you were exposed to childhood mistreatment, you were 1.3 times more likely to binge drink at least weekly. That actually translates also to a risk that you are 2.6 times more likely to have a severe alcohol use disorder, just by virtue of the fact that you have been exposed to childhood mistreatment. And remember, you can have the childhood mistreatment under the age of 12, and you can develop the alcohol use disorder at the age of 60 as a result of this correlation. So the key thing to understand is that the causes of addiction are many, but we need to understand the genetic vulnerability, which is about 50%. We need to understand the psychosocial context, including the trauma context, and then we need to understand the addictive potential of the drug itself. So hopefully we have an understanding now of what causes addiction when we're looking at someone who presents to us with addiction, and hopefully we'll be able to look at them through the lens of empathy and compassion. And remember, another great quotation that I like from Gabor Mate, He actually said, "Ask not why the addiction, but rather why the pain." That's all for today, folks. My name is Dr. Ferghal Armstrong, and this has been Cracking Addiction.